is now.
This is Cincinnati Edition on 91.7 WVXU. I'm Lucy May. Republican U.S. Representative Brad Wenstrup announced in November that he would not seek re-election in Ohio's 2nd Congressional District. He's been re-elected to Congress with ease 5 times since 2012. His retirement announcement lit a fire under several GOP candidates running to succeed him. Joining me in this recorded interview to discuss his decision not to run again and what he's planning to finish before he leaves office is Congressman Brad Wenstrup. Thank you so much for being here, Congressman Wenstrup.
It's my pleasure. Thank you for having me today.
You announced in November, as I mentioned, that you would not seek another term in Congress. What prompted that decision?
Well, it really was a decision that my wife and I made during the last term, that this would probably be our last term this time. There was an opportunity to look like we could take back the House and be in the majority again, which is, of course, is anyone will tell you, it's a lot more fun when you're in the majority, usually. But we had decided that this would be it. I never intended to be a congressman someday. This is just something that came along, and we can talk about that. But the decision was made because my kids are 10 and 6, and I was missing too much. And it was really hard, and we didn't know how long we'd necessarily stay during this term. Planned on possibly the whole term. But when I got back in, I got a waiver to stay on Intelligence Committee, which normally after 4 terms you're out, and this would be my 5th term of my 6 terms in Congress. And then I was asked to chair the select subcommittee on the coronavirus pandemic, which is something I was very interested in doing, and I think a very important thing for us to do as a nation. And so I said to my wife, well, it looks like we'll stay the whole time, and we'll announce in November to give people time to run for the seat. And as you mentioned, quite a few people have stepped up to take the spot.
Yeah, there's definitely a lot of interest. And certainly wanting to spend more time with your family is completely understandable. Did the divisions within the Republican Party in the House have anything to do with your timing?
No, there's always been some divisions. There's divisions within both parties, and both parties will tell you that if they're honest, that there's going to be some breakaways on some things, but it really didn't. And I've been asked a lot of times, well, is it all the chaos? I said, well, there's been a certain level of chaos since I've been in Congress the whole time. And as a soldier who's been to war, I'm used to chaos. I can muddle my way through that and continue to work. And I think that's something that we've been able to do. And I'm very proud of that because, a lot of times when you get things done, no one hears about it. It's only the things that are really stuck in the mud, if you will, within Congress that get a lot of attention. And in the meantime, you can get a lot of things done for the American people, not only serving in Congress and things you might get passed, but the constituent service that you can provide for your constituents, which has been one of the things that I've been really proud of. We've always had a good team helping people out if they have a problem with the IRS, the VA. I had a lady one time, she said to me, she goes, Congressman, you don't represent me. I said, well, actually, I do, because if you have a problem with the IRS or the VA or Social Security or any of those federal agencies, I want you to call our office, because we'll help you regardless of our differences of opinion, maybe on some policy. And so I think that's been one of the highlights where people never see the work that you end up doing for your constituents in a lot of ways. And as we go forward, and what we've been doing, especially in the last few years, is be able to direct spending to your district to things that people need. And those are some of the things I want to accomplish going forward, is to continue with that.
You've certainly seen a lot in your time in Congress, and I want to ask you about one particularly difficult chapter. Many members of your party voted against certifying the results of the 2020 presidential election. You voted to certify. You also signed on to an amicus brief asking the U.S. Supreme Court to look into election results in Pennsylvania. Why did you decide to do that?
Well, questioning your government is part of the American process. And I felt that the Constitution was violated in places like Pennsylvania. The Constitution clearly says that the state legislatures will determine how the elections are run. And in Pennsylvania, a judge decided you could vote for 3 more days. That violated the Constitution. It went to the Supreme Court. The Supreme Court did not take it up. A lot of people think they settled it. They did not. What they said was before the election, no one was harmed, and afterwards, it's moot. And I can disagree with that. A lot of people can, but the Supreme Court has never taken that up. But to me, it was a violation of the Constitution. Why did I certify? Because the Constitution says that our job on that day is to count the votes and to certify, to take what the state sends you. I believe in states' rights. If states mess things up, regardless, my job is only to count what they send us. So what no one knows, and even my colleagues on the other side didn't seem to know when I had conversations with them, because I questioned this as I came in when Donald Trump won. I saw Democrat after Democrat after Democrat all day long trying to challenge the election and to oppose it, which is what the certification process was. But my question is, why are we allowed to oppose? The Constitution says we're just supposed to count the votes. I mean, I even saw Joe Biden in the chair telling Democrats it's over. So you can keep doing this all day, state by state, but it's over. So this was not new. The big question is, and you probably don't know, and I'm sure most of your listeners don't know, why are we even allowed to oppose then? It's the Electoral Counting Act of 1876. And what was happening then is some states were sending 2 slates. So Congress had to decide which one they were going to count. And if the House disagreed with the Senate, then they would take whatever the governor sent. We need to get rid of the Electoral Counting Act of 1876. And then you don't have this problem. But states also need to only send 1 slate. It's outdated. It doesn't pertain to today. And so my job was just to count what the state sent. But I don't think that states did things right. I'm not saying the election was wrong or would have been different, but states did not do things right when a judge or a secretary of state changes the rules of the election because the Constitution says it's up to the state legislators.
In this recorded interview with Congressman Brad Wenstrup, who announced in November that he would not seek re-election. I want to talk about what you've been doing more recently. You're chairman of the House's Select Subcommittee on the Coronavirus Pandemic, as you mentioned. What's the goal of the Select Subcommittee?
Well, it's a review, basically, and I'll use my military terms, and I'm honored to chair this. And I asked my friend, Democrat emergency physician Raul Ruiz, and we do many bills together, to come on board and be the ranking member. But it's really an after-action review and lessons learned, and so that we can develop a path forward. You know, this was a novel virus and a devastating pandemic. And so we're looking at everything that was done as best we can. And we have to admit to some mistakes we may have made, and we also want to tout the things that we did right. So we're looking at the effects of lockdowns, school closures. We're looking at the effects of the bills that we as a Congress passed, most of them bipartisan. Were they helpful? What problems did we have with some of these bills? We want to look at the Operation Warp Speed vaccine development. I think most would agree that was a pretty amazing chapter in all of this, the logistics that took place to get the vaccines out. And look at the origins of COVID. And I can tell you, somebody who sits on an intelligence committee who studied bioweapons, and you see this coming out of China, where they have bioweapons within their military as one of their priorities. You have to take concern about the origins and the capabilities of creating viruses. But whether something came from nature, whether it came from the lab, whether it was generated through animals in the lab, or whether it was just created flat out in the lab, we have to be prepared in the future. So I keep talking about the 4 Ps. I want us to be able to, as best we can, predict the next pandemic, which I think all the scientists want to be able to do, and to be able to prepare for and protect ourselves and maybe even prevent the next pandemic. So that's the goal. And so we're bringing in a lot of scientists. We're bringing in the agencies that dealt with the pandemic and all the people that dealt with the pandemic. and getting their view on what happened and why decisions were made. And do they still feel that it was a good decision? There's nothing wrong with that because we knew nothing when this started. And so we had no definitive treatments. We had no tests. And we were doing the best we could as a country. And I think we did some things very well. But there's some things you can say, boy, that really didn't work. Maybe it was a good hypothesis at the time, but this virus was different. And I'll give you an example of that. It was said, well, this is a coronavirus, and a lot of those viruses go away in the warmth of the summer. Well, fair enough, because that's true. But this one didn't. And, that we should have probably said to the American people, boy, we need to really buckle down on this because it's not behaving like the others. And the other thing that I thought was important, because nothing about this should have ever been partisan in my mind. This has affected anybody of any persuasion, of any color, and people were dying all over. This was a global problem and certainly an American problem, and it never should have been partisan. And so I think that we need to come together on this and work through it. Because this is something that affected absolutely everybody, and I'm not sure why it's partisan. I don't look at it as partisan, but we just need to find truth. And to me, honesty is non-negotiable, or is non-negotiable through this process.
In looking at this response and reviewing response from the government, from the nation, are you looking at how both the Trump and Biden administrations responded to the pandemic?
Oh, absolutely. It's from beginning to end. And, when you talk about the agencies that were involved, our health agencies, it's how can we do things better? And, the personnel, you may change the director or the secretary, but the personnel in there is the same. And the guidelines going forward are what we go by, no matter who is in the White House or in the House or Senate, for that matter, when it comes to public health. So, the one thing that I think we missed out on is, and I said this during the Trump administration to the Secretary of HHS, I said, I think America needs to be hearing from the doctors that are treating COVID patients. I think it would be more effective. And I think that would have reached the American people more. In my mind, I'm old enough to remember the Gulf War, and we didn't hear from the president every night during the Gulf War. We heard from General Schwarzkopf, and Americans across the board tuned in to hear what was going on, and they were hearing it from the person that they knew and trusted and who was in the trenches. And I just think that's a lesson learned for us going forward, that we're good. If we're going to espouse to people, let's hear from the people that are actually taking care of the sickest of the sick in this situation, to let America know what's going on, what they're seeing the risks are, and as far as treatments, what works and what doesn't work.
You mentioned how novel this whole situation was, how much, we as a world didn't know about COVID-19 when this all started. Do you think former President Trump has any responsibility for not acting more quickly at the start of the pandemic?
Well, actually, when he acted quickly, he was criticized, wasn't he? I mean, one of the things that people agree with is restricting travel. I mean, we went to lockdowns and everyone agreed with that. When he went to restricting travel, he was called a racist. Now, see, that doesn't help. That's politics getting in the way of science. And the science said we should restrict travel because it's spreading from person to person. There's human to human transmission here. So I will also say another thing, acting more quickly. I think we acted as quickly as we knew information and could verify information. And listen, again, it's novel. So there's going to be mistakes and there's going to be unknowns. And so you can always look back in retrospect. But I will tell you what was a problem. And I see the president getting criticized for this. President Trump came out and said that everything seems to be under control in China. Well, that's what President Xi was telling him. And that's what the WHO was telling him. So this is part of what we're looking back on as well. So if this is, then we have to look into, and part of our investigation is the functionality of the WHO. And are they under the influence of individual countries, or can they be independent across the board and truly evaluate? Keep in mind, we weren't allowed to go in. we weren't allowed to go visit China and really get an understanding of what was taking place. So how can you be as accurate? So you rely on what President Xi is saying, and you rely on what the WHO is saying. And so that didn't help things. And that's a process we have to clean up too. And we are currently working with the American personnel that deal with the WHO on reforms for the WHO, and we had them in for a hearing the other day. So it's easy for people to sit back and criticize when they're not really looking back on what we only knew at that time. And that's an important component of what we're doing. What did we do with what we knew at the time? Because that's the only way it can be fair.
I know Dr. Anthony Fauci is going to be testifying before your select subcommittee. What do you hope to learn from him?
Well, certainly he's a brilliant man, and I don't think anyone disagrees with that. And he was the face of COVID during this time. And so this is important. This is an opportunity that we need for this committee to have to talk to him and talk about exactly what I was just talking about. What was going through your mind at the time? What did we know? What didn't we know? And when decisions were made, why were they made? Now, we have a broad government. We have a lot of agencies, so a lot of decisions were made in different places. And so we're just going to ask them, where were you able to advise? Where were you not able to advise? Is there anything you look back on that you would want to have done differently in retrospect? And again, why were decisions made? If we don't look back, we can't do better in the future. And so that's where I intend to go. And there are a lot of questions to be asked about why certain decisions were made and what information were you using to make those decisions. And that doesn't mean something was wrong necessarily. It's just that was the situation at the time. And so how can we get better at getting information?
I know Dr. Fauci has faced a lot of threats related to his work over the course of the pandemic. Do you think being the focus of a committee hearing will have any consequences for him? Is that a concern at all for you?
Might have consequences for me. Did you ever think of that? This goes both ways, unfortunately. That's government as we know it today, unfortunately. Believe me, I've had threats, and I'm sorry he's having threats. I'm sorry that I've gotten threats. I've had things sent to my children. Fortunately, I opened them first. So it's very unfortunate. I know that he still has Secret Service detail with him. That's unfortunate. But at the same time, maybe they'll go away because there really hasn't been an opportunity. When he's been out speaking, he's mostly out speaking as he would like to tell the story. And he hasn't really had to answer a lot of I know my constituents have in their mind.
What work are you hoping to complete before you finish your term?
We've got to complete this subcommittee because it's a select subcommittee and it's only there for one term. Look, I've had such an opportunity in Congress. I ran for Congress because I looked in D.C. and I thought we've got people making health decisions that never saw a patient, people making military decisions that never served people, making business decisions that never ran a business. And I had all three of those and people were encouraging me to run. So I'm glad I did. But I've had the opportunity to serve on Armed Services Committee, on the VA committee. I served on health. We got the Mission Act done. I've been on Intelligence Committee for 5 terms. I served in the military for 25 years. I just retired from that last year. I was medical policy advisor for the Chief of the Army Reserve, and I was on staff at Walter Reed. So my interests have been in large part national security and health, but on Ways and Means, we do a lot of health. And I'm chairing our Doctors Caucus, which is 20 members, physicians, dentists, and pharmacists. So we want to complete the pandemic report. I've got a lot of things to do in health that I want to accomplish. In Washington and too often through the country, health becomes a political football in some ways, and we'll talk about Medicare, Medicaid, and the Affordable Care Act and insurance. But I really want to change the focus, and certainly those entities will fall underneath here. But How do we become, as the United States, the healthiest nation on the planet?
Well, let me ask you this, Congressman Wenstrup. Would you consider getting back into politics in some way in the future? I know you said your children
Oh,
are little
yeah,
now, 6 and 10, but they grow up fast.
they do grow up fast. No, I don't rule it out. I'm not ruling out anything. I don't know what I'll do next. Uh, I have to remind people, one, I'm not retired yet. It's not till the end of the term. And two, I'm not retiring from work. One of the other things that comes with having a 10 and a 6-year-old is it's important that you keep working.
That's right. They have a tendency to use up those paychecks, huh?
They do.
Yeah. Well, I've been talking today with Congressman Brad Wenstrup. Thank you so much for your time. I sure appreciate it.
Thank you very much.